Hello, my name is Julie Hebert. I'm here to go over your employee benefits for the year beginning June 1st, 2022. This recording is for Energy Edge Consulting and for H3W employees. So please, for the sake of this, we're just going to say Energy Edge, but realize that we're talking about everyone. Here's my contact information, email, phone number. Please don't hesitate to call me anytime. My dad is Jim Hall, and he's working towards retirement, but is still available if you have a question or need something. So we're going to get into this overview very quickly. This year, All Savers had a significant rate increase, and so we are going to move the group to Blue Cross Blue Shield. I think you'll be very happy with their network. They have a great network in Texas, wide range of doctors and hospitals, and I think you'll be very happy with their customer service. The dental and vision and life insurance and long-term disability will remain with Lincoln Life Insurance, so that will make that part of it easy. We'll just be changing the major medical. So your employer provides each employee with $50,000 of term life insurance and $50,000 of accidental death and dismemberment coverage. This benefit does reduce as you age. You'll notice there. If you were to pass away in an accident, you would receive $100,000 of life insurance. If you died of natural causes, it would be $50,000. We encourage you to keep your beneficiaries up to date. You'll have an opportunity to do that through ease each year, but if something happens and you have a family status change, be sure and remember to update your beneficiary. Energy Edge also provides each employee with a long-term disability insurance, and it will pay up to $10,000 a month, 60% of your salary up to $10,000. It begins after a 90-day waiting period. The benefits will continue as long as you're disabled all the way until your normal Social Security retirement age. So this is a great benefit that's provided by your employer. Dental insurance is available to you and your dependents through Lincoln National. You can visit any dentist. However, you will save an average of 30% when you visit a Lincoln Dental Network doctor in their PPO network. This is some information here about how to find a dentist in your area. Please know that you have an annual deductible of $50 per person, a maximum of $150 per family. You can go and get your teeth cleaned twice a year and get x-rays, and that's covered at 100% with no deductible required. If while you're there, they say, oh, Julie, I'm sorry, you do have a small filling that needs to be done, you're going to pay that $50 deductible. They're going to cover your filling at 80%. You're going to pay 20%. If the next time you go back, they say, uh-oh, now we need to put in a crown, you're going to pay 50% and they're going to pay 50%. You have a maximum annual benefit, of $1,500 per person. You do have an orthodontia benefit of $1,500. So you get 50% up to $1,500 for braces. Here's your monthly payroll deduction amounts to cover you and your family. The vision insurance is also through Lincoln National. Again, you'll have tremendous savings if you can manage to stay in the Lincoln network. There's some information there about how to find your provider. You're in the Lincoln Vision Connect network, so that's important to know. You can go get your eyes checked once a year for $10 copay. You can do that every year. You can get new frames. They have a $130 frame allowance. You can get a new pair of glasses every year, frames and lenses. You have a $25 copay on the lenses, so the inside is $25 and an outside part of a $130 frame allowance. You can also get contact lens in lieu of glasses for a $125 allowance. There's your monthly payroll deduction. So now let's get into the meat of this, going over the medical insurance. So this year you have a choice of 3 plans from Blue Cross Blue Shield. So this is a new carrier, new plans. So please take a moment and listen to this important information. There are 3 plans. 2 of them are PPO plans. 1 plan is an HMO. Please note the difference between these 2 types of plans is an HMO requires you to select a primary care physician and all your medical care is directed by that primary care physician. Under a PPO plan, you can go to any Blue Cross provider and it's a larger network. Some hospitals are not in the network under the HMO plan, but they are in network under the PPO plan. These include such doctors and hospitals associated with Methodist Hospital, MD Anderson. There's several of the larger hospitals that are not in network for the HMO plan, but are for the PPO. And also know if you're on the HMO, you have to go to an in-network provider. Otherwise, you're not going to have any coverage. So let's go briefly through this summary. So the PPO $3,000 deductible, this is your traditional plan. This is similar to what you have with All Savers now, with the majority of the employees are on. You have a $3,000 deductible. Then you pay at 80, the company pays at 80%, you pay at 20%. On this plan, you have a copay to go see your primary care doctor of nothing. It's free. But if you go see a specialist, it's going to be $80. This plan does cover x-rays and blood work under the deductible and the 20% coinsurance, as well as imaging, outpatient, inpatient, and emergency room visits. Urgent care is $150 copay. We encourage you to make sure you know of an in-network urgent care facility close to you, your home, or your office. That way you know you're going to an in-network provider. There's a prescription drug copay of 0 to 10, depending on if it's a generic, if it's a preferred name brand, what type of medication it is. So then there's also a choice here of the PPO HSA eligible. So this plan is a high deductible health plan, and it would qualify for you to combine that with an HSA savings account, which we'll talk about in a second. Again, both of these are PPOs, and they use the Blue Choice Network, which is the widest network that Blue Cross has in Texas. You don't have to have a primary care physician, and you don't have to have a referral on either of the first two plans. This plan does have a $6,000 deductible, and the way this plan works is that every dollar you spend on your first $6,000 in medical care is only covered at the allowed amount. You pay out of pocket up to $6,000. Once you reach that $6,000, everything's covered at 100%. You have no further obligation, but this includes prescriptions, doctor visits, everything that you do. The third plan, this is kind of a new thing for you guys. There's an HMO option available to you. It's very similar plan design as to the PPO $3,000 deductible, similar copays, similar coinsurance, doctor copays. All of this is very similar. The biggest difference is right here. We have a Blue Choice network versus a Blue Advantage network. So that Blue Advantage network is much smaller in the Houston area than the Blue Choice. And also you are required to have a primary care physician and go through that doctor to get all of your care. So the great thing about the HMO plan is if you elect this, it is free to all employees and their dependents. Energy Edge or H3W is going to pay the full amount of this cost. But I just urge you to do some research and make sure that you're going to be happy with the doctors and the hospitals in this network before you make that option selection. So it's important to use providers that are in the Blue Cross Blue Shield network. You can go and locate a provider right here. There's the bluecrosstexas.com, find a doctor. If you're on that HMO network, you're going to select Blue Advantage HMO. If you're on the other first two choices, you're going to select Blue Choice PPO. So that's a really important thing when you're going to look for a provider. You will have better prescription co-payments if you go to a preferred pharmacy such as Walgreens, H-E-B, Walmart, Albertsons, Access Health. CVS is not an in-network provider for Blue Cross. You can go there, but you will pay more for your prescriptions. MD Live is an option for you to call an 800 number and you can have a doctor call you back. It's a virtual visit. It's much easier and less expensive than going to an emergency room. Preventative care is covered at 100% on all three plans as long as you go in network on the HMO plan. It does include lab, x-ray, pap smear, mammogram, prostate screening, child immunizations, flu, and child vaccinations that are required. So as I mentioned on that middle plan, the PPO plan with the $6,000 deductible, you are eligible to combine that with the health savings account. A health savings account is a tax advantage trust account created for the benefit of an individual covered under a qualified high deductible plan, which that plan S9M4CHC is an HSA account. So you can open that at any banking institution and you can either fund this account as you need it or in one lump sum at the beginning of the year. Whatever you contribute up to $3,650 this year or $7,300 per family would be tax deferred. You would not pay any income tax on that. If you're over 55, you have the option to add an additional $1,000 to that and to bring your totals to that. You can always use this account regardless of your employment with Energy Edge. So that's one nice thing. If you put the money in there, then you move to a different employer, you can still use the money, or if you retire. The funds can be spent on any IRS approved medical, dental, or vision expenses. So any co-pays, any prescription co-pays, any dental work, eyeglasses, anything like that you have done. You can also use them for hearing aids, things like that. When you become 65 years old, if you don't want to use it for medical expenses, you will pay a income tax on the amount, but you will not pay any penalty. So the HSA does provide triple tax savings. It's a tax deduction when contributions are made. It's tax-free earnings throughout the account's earnings, tax-free withdrawals for medical expenses. Happy to answer any more individual questions about that, but remember that is that middle plan, the PPO plan with the $6,000 deductible. This is your open enrollment period, so we encourage you to make changes. This is the time if you want to add or drop for any reason, this is your time to do so. If it's after June 1st, you would need a life event to make a change, such as the birth of a child, a divorce, or a loss of coverage through your spouse's employer. Here's just some more required information. That's about if you leave Energy Edge and you want to continue your coverage. That's about Medicare coverage. We are going to continue to use Ease Online for our enrollment system, and this just gives some brief instructions on how to utilize that. You guys are all pretty familiar with it by now. Also included in this document are some flyers from Blue Cross Blue Shield on how to register to become a member of the Blue Cross Blue Shield community and to learn more about your benefits. Here you can look to see, you can look up all kinds of information about your account. You can get a temporary ID card. You can look for explanation of benefits. You can look for member discount programs. There's a lot of information on the web and on your phone that you can utilize with Blue Cross. This gives some information about your pharmacy benefits and how to get the best value from those. This is information on how to get the Lincoln Dental mobile app. It's the easiest way to use your Lincoln benefits. You can get a mobile ID card. You can look for doctors, lots of information there. Here is the full details of what's covered in your dental plan and your life and AD&D and your long-term disability. Here's information on your vision plan, some more details about that. And I think that's it. The most important thing to know is that this is your open enrollment. This is your time to make choices. If you have any questions at all, please don't hesitate to contact me. This is a big change with the health insurance this year. I'm happy to answer any questions. There's my phone number and email. We're always here to help. So thank you so much. We appreciate you.